Left gastric vein drains into portal vein. The left and right gastric veins drain directly into portal vein. Short gastric vein and left gastroepiploic drain into splenic vein, and right gastroepiploic into superior mesenteric vein is one of the favorite topic of examiner. If the facial nerve is injured, what glands is it? A secretomotor nerve. It is for the sublingual, lacrimal and submandibular, but not for the parotid. And for the parotid, it is the glossopharyngeal nerve, which is the one which provides the parasympathetic innervation, is what you need to remember. Now, what structures are involved if you damage the free edge of the lesser omentum? So, the right free margin of the lesser omentum you can imagine between stomach and liver. So, portal vein, common bile duct, hepatic artery and portocaval lymph nodes, and the hepatic plexus of nerves are the ones which are typically located. Now, coming to the tongue, all the remaining are true. Facial nerve supplies fungiform papillae, glossopharyngeal supplies circumvallate papillae, and genoglossus is called as safety muscle. Then all pharyngeal arches, and what are their derivatives? You need to be 100% sure about what is the nerve of the first, second, third, etc. etc. So, tibial nerve palsy, what does it lead to? It leads to the loss of the dorsiflexion of the foot at the ankle joint, is what you need to remember. If you look at the dorsum of the foot versus the medial border of the foot, so L5 innervation is for the big toe, S1 is the innervation for the small toe, is what we need to basically remember. Now, the patient, what is she having? Central cyanosis. So, for the central cyanosis to occur, how much should be the reduced hemoglobin? Reduced hemoglobin should be at least 5, more than 5 is the point of interest. What is this spine called? Rugger-Jersey spine, which occur because of the secondary hyperparathyroidism. So, what will parathormone will be doing, doctor? It will increase the resorption of the bone and lead to Rugger-Jersey spine. Spirometry cannot measure any value which has a residual volume. What is residual volume? After you breathe out the air, the amount of air left over in the lungs is called as residual volume. So, anything linked with residual volume, like functional residual capacity, cannot be calculated. Total lung capacity also require residual volume. It cannot be calculated by the spirometry. So, what are all the polar amino acids? So, serine, tyrosine, lysine, but not tryptophan. So, you need to be quite sure. Polar, non-polar, simple mugging business. Nothing to do with intelligence. Essential, non-essential, ketogenic, glucogenic. So, one amino acid based question generally comes. So, what is the irreversible step in glycolysis? So, if you look at the hexokinase, phosphofructokinase or any kinase is basically irreversible, right? So, if you join government college, government seat, sometime you may change the mind and get out of it. But you paid 50 lakhs or 1 crore, kinase, phosphate is exhausted. It becomes irreversible post-graduation, right? So, that's how. Now, what is the urea cycle enzyme? Arginosuccinate synthetase out of all this. Protein separation methods include all this, but not native gel electrophoresis, ultracentrifugation, ultrafiltration, etc. They are all. Selenium lead to Cashon's cardiomyopathy. Then there is all the life cycle of what? Where you have hydatidiform mole, you are having rhabdoitiform larvae and filariform larvae that penetrate the skin. Strongyloides torcoralis typically has got a life cycle like this, is the point of interest. What is shown to you? Don't tell it is a honey bee, it is a tick. So what is a tick? So इमेज बेस्ड एग्जाम बोले तो जरा जरा आप जो इमेजिन कर रहे हैं एक बार एक मर्तबे गूगल इमेज में देख लीजिए, स्टेप वेल कैसे दिखता, डग वेल कैसे दिखता, सेप्टिक लैट्रिन कैसे दिखता, और यू हैव गॉट डिफरेंट काइंड्स ऑफ लैट्रिन्स अवेलेबल डिपेंडिंग अपॉन विलेज, डग लैट्रिन एक्सेट्रा. एक बार देखना पड़ता क्योंकि सफाई का काम करना पड़ता एमडी सीट में आने के पहले. तो tick borne is the rocky mounted spotted fever is a point of interest. Pertussis, there are no chronic carriers of pertussis, and the source of infection is directly another case of pertussis is what you have to basically remember. These are all acid fast but not rickettsiae, as you know very well. Now what do you see? Drug ECG means long QT syndrome. There will be nothing else. Don't think of anything else. Of course, digoxin can cause check marks, and there are some drug induced effects on ECG. 4 or 5 drugs are there. Long QT. What are all the drugs that cause long QT, doctor? Haloperidol, amidorone, cetalol, they have all been included, whereas fexofenadine does not. Now this is the most important list, doctor. If you did this question wrong, seriously you must go back and review classification of the anti-neoplastic drugs. Straight that is going to come in tomorrow's exam, paper out, right? So definitely it will come. One of the anti-neoplastic drugs, right? So you have to read. Alkylating agents are all cell cycle independent, doctor. Simple. Which are M phase specific anti-microtubule and anti-tumor antibiotics and topomerase inhibitors are all M phase. Then you have some of the anti-metabolites which inhibit the DNA, S phase specific. Similarly, you are having some S phase specific. I read the literature for you. So alkylating are, they are not specific to any of the cell stage, and which is an alkylating agent out of this busulfan is a alkylating agent among the anti-neoplastic agents is what need to be remembered. Ganciclovir is very much active against the Kaposi sarcoma associated herpes virus is what you need to be quite sure. Then the various toxins, mechanism of action is a favorite question of the examiner. So if you look at the botulinum toxin, it will inhibit the release of the acetylcholine, not a massive release. Imipramine is a norepinephrine and 5-HT reuptake inhibitor is the point here. In addition to its tricyclic, it being a tricyclic antidepressant, its mechanism is to act like a norepinephrine and 5-HT receptor reuptake inhibitor. Then which a drug pair is properly matched out of all this? Buspirone is 5-HT1 agonist, true. Then Cisapride, which is a prokinetic drug, is 5-HT4 agonist as well as a 5-HT3 antagonist. Then granisetron is a 5-HT3 receptor antagonist. Then you have TNF alpha inhibitors like infliximab, cetrolizumab, and etc. etc. Everyone says only 5 marks is pharmacology, but don't forget, those who didn't read will get 2 marks and toppers will get 4 marks out of 5. The 2 marks definitely make difference. So that is the reason at least top 20 topics given in the classification of high yield topics try to review. What is the effect of phenytoin? Phenytoin lead to thrombocytopenia, not cytosis. Aplastic anemia, megaloblastic anemia, even hemolytic anemia. You may be thinking, will it cause hemolytic? How many answered hemolytic anemia? Yeah. Examiner has got that seductive options, completely like a pole dancer. He will try to make you feel that you are almost getting orgasm of answering correctly, but you will be ending in a wrong answer. So be very sure. So single gene disorder, type 2 diabetes is multifactorial, multi-gene disorder, as all of you know very well. Very happy to see Dr. House, Anu, everybody. Now we are also spiking up with setting a question paper that does not depress you, at the same time does not elate you. How to create that equanimity we are trying. I thought of doing like that in the January, February. I mean in the January 3rd week, but already February 28th expected date of delivery aa gaya na. Abhi Braxton Hicks have started in our mind, so I can't create a tough paper and unnecessarily trouble you, right? But these are all the things. At least now you should aim to cross 140. If you could not cross 140 in Murli Bharadwaj exam, NTR will be feeling bad in his graveyard. NTR UHS will be, you will definitely not cross, right? If you cross 140 with us, take it as my guarantee that you will also cross 115 NTR UHS. If you cross 150 score of our exam, definitely you will be in that 165-170 batch in the actual entrance exam. Next 8 weeks, oh hai, challenge. We have another 15 exams now. So if you are, you try to see, can I cross 140 or not? If you cross 140, definitely no one will stop you. You will cross. Okay. So both B and T cell defect. Once more, I want to tell multiple times that immunodeficiency disorders, the 2 pages of Anantanarayanan. If you don't read, at least we will send you one WhatsApp message until you say stop this message. Some topics we will start sending you. Shall we send you? Have you read? Have you read? Have you read? Like a tired middle-aged housewife reminds a andropausal husband about getting the supermarket objects. So we need to remind you. So both B and T cell, Vishkutavich is an example. Severe combined variable immunodeficiency, another example of both B and T cell. What is the speciality of factor 13 deficiency? Factor 13 deficiency ऐसे चीज है जहां bleeding होता है मगर PT-ABTT normal होता है. Factor 13, where will factor 13 will occur? So give me the, okay. Where will factor 13 occur basically? You have a factor 7, which is extrinsic pathway. 2, 5, 10 is the common pathway. Can you please give me the board, please? So yesterday you attended orthopedics class by Dr. Selvarajan, who came all the way from Chennai to review the last 15 years of APPG questions. Excellent class. If you missed it, review it in the APPG crash course video. So doctor, factor 7 is extrinsic pathway. 2 is prothrombin, become 2A is thrombin. For this it required 5 and 10. 5 and 10. 2 5 are 10. Then everything else, factor 8, factor etc., 9, everything comes under APTT, intrinsic pathway. After the clot forms, there is something called fibrin stabilizing factor, which is factor 13. So इसका importance कब आता? After PT-FTT is over, factor 13 is involved. If it is deficient, neither of the PT-FTT get affected. But the fibrin clot formed is not stable one. That's the reason the patient will have clinically a bleeding diathesis, but normal PT-FTT. What is the other situation? If the factor 12 is involved, then APTT become prolonged, but still patient will not have bleeding diathesis, right? So this is the reverse situation to this. these two plus what causes PD prolongation? Factor 7. 2,5,10 is common, both PD hepatitis. Everything else is hepatitis. Okay. So that you need to be very sure about. Now, yeah. So what is wrong about? So very happy to see yesterday ortho class went on very well, morning 9 to 8, 9 to 7. And tomorrow you have Dr. Bari Ahmad Siddiqui, who is Shahan Shah Mahabali of biochemistry, will be teaching you biochem morning, all last 10 15 years of AP PG and Tamil Nadu PG biochemistry questions topic wise. Reviewing that is worthwhile. So what is wrong about this condition? So what is this condition? Both the kidneys are joined, and what is this called as horseshoe kidney. So horseshoe kidney, typically where will the fusion occur? Fusion occurs in lower pole, fusion occur in upper pole in, I will just recheck this answer, we will recheck this answer and update you. Then tumor cells avoid immunogenic mechanism. How will they be able to avoid? These are all the mechanisms, but it is a decreased expression of MHC class 1 but not MHC class 2 is what you have to basically remember. That's how it escapes. Then regarding NK cells, they have a role in cell-based immunity. They are CD1656 positive, and also they are very important in protecting against the viral infections, and they are important for tumor surveillance. So natural killer cells is a favorite topic of examiner. About postmortem staining, it is very common in the dependent part is a true thing. And the cadaveric spasm, it will disappear with rigor mortis. It is seen in voluntary muscles, and particular group of muscles are involved. They are all the true things. Isolation is no more advised in TB. If we use common sense, we will try to think of TB as isolation required, because older days, where was Nehru's wife? Nehru's wife was living in had TB. Jab Pandit ji is struggling for many things, so she was receiving, earlier days they used to have TB, what are they called? Sanatorium, where it is a sort of an isolation, or people used to go to the hilltop to get a fresh air. But nowadays that isolation is no more indicated. Screening is effective in all but not in carcinoma of ovary. Carcinoma of ovary may, by the time the patient become clinically identified, patient will be in a very late stage, carcinoma of ovary. So that's the reason there is no role for screening. Vaccines are not contraindicated. If it is rabies or hepatitis B, which is not a live attenuated, you don't need, it is not a contraindication. 100 grams of what is this called as? Pear? Date, okay. Date. So 100 grams of dates, what do they contain? Disgusting question. First to know that these are called dates is a little challenging, because अंग्रेजी में क्या बोलते हैं उसको मालूम नहीं, मगर dates में क्या रहता है मालूम होगा. So the dissociation between the parietal lobe and temporal lobe is the challenge in this question. So doctor, vitamin C इतना नहीं रहता, मगर calories, iron, carotene, they are all true. The disease is infectious before the onset in mumps, measles and hepatitis B, but not in cholera. HPV infection, typically it is recommended for females 11 to 12 years of age with 3 intramuscular doses. The second and third should be given 2 to 6 months after the first. 2 and 6th month after the first. So that is the recommendation. It protects against HPV 16, 18, etc. They are all true. If you have done this question wrong, in this country, Ministry of Health clearly told, हर एक एग्जाम में एक HPV क्वेश्चन होना, नहीं तो examiner will be debarred from conducting exam. So please review, because in our country carcinoma cervix being so common. A female of 45 years, category 1 dots for 6 months, yet she is AFB positive. According to the dots, how many months she need to continue the ATT? She need to continue for, she should be treated like a category 2, afresh is the point you need to appreciate. There is a chronic renal failure. What does this appearance show? Shrunken kidney. So if you take amyloidosis, diabetic nephropathy, multiple myeloma, they all lead to a CRF with a normal sized kidney, and pyelonephritis lead to a shrunken kidney. That is a point of interest. Then coming to amyloidosis. Amyloidosis is seen in medullary carcinoma, not in the case of the papillary carcinoma. It will lead to the derangement of the renal vasculature, and that is the reason it can lead to development of renal dysfunction, is what need to be understood. Autoimmune gastritis. It is not associated with H. pylori, but it leads to parietal cell atrophy, autoimmune disease, and pernicious anemia is associated with it. They are all true. So what is this inheritance pattern? Every time only the guys are getting affected. X-linked recessive. So Wilson, Dukins and androgen insensitivity are all X-linked, but not hemophilia is, but not Wilson. Wilson is autosomal recessive is what you have to remember. Remaining are all X-linked. Then increased protein is a feature of TB. Then GBS also you have albumino cytologic dissociation. Albumin increases but cells will not increase. In case of GBS, Guillain-Barré syndrome, and even in multiple sclerosis. In ADPKD, the loss of heterozygosity and somatic mutations are the dominant inheritance. They are all true in case of ADPKD. It is not a single gene mutation associated disorder. So you must know what disorders are like thalassemia, sickle cell anemia, single gene mutation, and some conditions are chromosomal deletions and translocations. So what is the genetic mechanism of the various conditions is the important issue. Now what you are seeing is the presence of a lot of collateral vessels in the front of the chest, which is typically seen in superior vena cava syndrome. So it is seen in lymphoma, squamous cell carcinoma and even small cell carcinoma, but not in multiple myeloma. So what is the oncogene for tyrosine kinase? BCR, ABL, MET and JUN. They are all, but not BRCA1. There will permeabilization of the membrane occur mitochondria in case of apoptosis. If you did this question wrong, how many did wrong? So apoptosis you did wrong means you are not in that cabinet. You are only a MLA, not a minister. So I said topic hai apoptosis. Pakadna, padna. Definitely one question will come, apoptosis. You will remember me. So copper containing enzymes are cytochrome oxidase, superoxide dismutase and tyrosinase is what you need to remember. Now chaperones have a wide range of pleiotropic effects and expression. They are called heat shock proteins and they are present in bacteria. They are all true. Then what is the story of ubiquitin? So basically in the protein degradation, proteasomes lead to protein degradation. So there ubiquitins play a very, very important role in directing the proteasomes to degrade the correct type of protein. They will label it like a address written on the postcard. So that is the role of ubiquitin. Ubiquitinated proteins are recognized the ones that need to get degraded. is what you have to be, you have to understand. Restriction in the nucleus, it is not only present in eukaryotes, but even in prokaryotes, and it restricts replication of DNA and it protects the bacteria from infection by virus. They are all the true statements. A child of 14 years met a blunt injury, and what did he develop? Hyphema, blood in the anterior chamber. So for that you will use tropicamide, mydriatic, prednisolone, carbonic anhydrase, but not phenylephrine. And why tropicamide is a preferred mydriatic? Because a short acting mydriatic. Phenylephrine is a mydriatic but a longer acting. So we don't want, if it is a longer acting mydriatic, what will it do? It will lead to formation of the synechiae, which we don't want. That's the reason we don't use. Then sympathetic ophthalmitis, immediately it is the sound eye or uveitis, where does it occur? Injured eye or sound eye? Not immediately. Okay, it takes time for it to happen. That's the point. Don't ask me how many weeks, I too forgot. But it doesn't occur immediately. That much we are very sure. Then doctor, what is this ophthalmoscopy called? Direct. Right? So direct ophthalmoscopy may, it will allow, will it allow? Yeah, it allows easy visualization of the posterior part of the retina. Commonly we use clinically. But there is no stereopsis, magnification is there, real inverted image, real inverted only, no? Which is magnified, real inverted, direct or indirect? Indirect. Retinopathy of prematurity, typically is seen in preterm, not full term, with a high flow oxygen. So that is a part of the story. Now let us go to the actual story.